Hello and welcome to the next installment of the Right Time Tuesday Live here at Spectrum Healthcare. Today we're actually going to get into the nitty-gritty of the methods that individuals can choose, and we'll be joined by Christy Stretz and Al Youngman, who are both educators for the Right Time program and would be your first person that you would interact with when you're choosing your contraception method. Now, before we get too far into this, we know that all of these things are personal and everybody has their own personal choice and beliefs on what and how they can address this. So if you do have questions, please contact us at info@spectrumhealthcare.org so that we can confidentially address your questions. Now, if you have general questions and you want to pose those through any of our platforms that we're streaming on today, please feel free to. But if you have specific questions about your personal choices or circumstance, I would encourage you to go ahead and email us at info@, and those come directly to me. So it is a confidential email that you can get responses to so that we can talk things through. So let's go ahead and get started and welcome in Christy and Allie. Welcome.
Hi, guys.
Oh, let's see. Oh, there we go. There, perfect.
Hi, guys.
So each month, we're taking time out to actually do a live stream for the Right Time. And before we get into whatever your method that you've chosen is today, can you give us a brief rundown of what the Right Time project is and how people can get connected?
I can take that one. So the Right Time is a program to try to reduce unwanted pregnancies in the state of Missouri. We provide a visit to our nurse practitioner, one of them, and pay for that visit if you are uninsured or underinsured. And we can provide the birth control of your choice to you for little or no cost. And we provide various methods of birth control, something permanent or semi-permanent like Nexplanon or an IUD. And then we have birth control pills, we have patches, we have the depot shot, we have the NuvaRing. So all of those options are available to you, and it's your choice. And we just want to inform you and let you make the best choice you can.
And all of the visits are going to start with an education piece, right?
Correct.
So they're going to meet with you, Christy or Allie, to go over all of the choices that they have before them.
Yeah, that's the best part of this program, in my opinion, is they get to see all the options out there and see what's best for them at this moment in their life plan, their family plan. And they can always come back and change the method if they don't like it that much, or if they successfully use the method and then a couple of years later they decide they want something less long acting. It's really cool, the education we're able to give them.
And we also have like tactile pieces, like they can actually see the size of an IUD. They can see the size of a NuvaRing, the patch, and they can actually touch them, look at them, ask questions about how they work.
Awesome. So each month we're taking the opportunity to come on here and talk about methods. So what method are we talking about this month?
The good old-fashioned birth control pills. We thought we'd start kind of easy with what people probably know more about than get into all the IUD stuff.
So let's just start and have you give us the basics of the pill.
Well, go ahead, Allie.
I was just going to start off with the fact that it is something that you take every day. It's a once-a-day pill, best meant to be taken at the same time every day, and it is meant to help protect against unwanted pregnancy. And it is something that allows the user to, they're able to usually purchase it or get it 3 to 12 months of a supply, so they don't have to back to get refills. It's something that I think is really good for people who don't have a long-term family plan. This has meant they can stop and switch whenever they need to if they don't like it. There's a lot of different types of hormone combinations, and there's some with less hormones, there's some with combined hormones, and then there's some with just progesterone only ones without estrogen. So if someone's interested in birth control, but is kind of wishy-washy on the hormones, there's lots of different levels of hormones and different types if someone wants to try those out. So there's a lot of options when it comes to birth control, which is great.
So why do we have all of those options with the pill?
Well, we have them all because every woman is different. And there are certain pre-existing conditions that you might have, maybe hypertension, maybe you have fibroids, uterine fibroids. You might have a history of DVT, deep vein thrombosis. And if those are the case, you would want to stay away from an estrogen-based pill. Those are things that you should probably go the progesterone-only route.
Also, to piggyback off her, there are certain things that women want in a birth control besides preventing pregnancy. And these different types of hormone combinations allow for people to help also manage other conditions they may have, like PMDD. Acne is a big one that a lot of people also go on the pill for to help regulate those androgen hormones. There's also a lot of things regarding hair loss. And so there's different types of combinations of pills that would be better suited for people who want to manage something other than just their pregnancy status.
Okay.
Right. They can manage their cramps. They can manage their blood flow, their blood loss. They may have low iron, anemia, and they need to kind of control that. So those are all things they can do. Or they may have excessive hair growth, and it will help with that problem too. So there are a lot of different reasons to have the different types so that it will fit the woman best. It's been around for 50 years, the pill has. It started the sexual revolution for women, and they have really dialed in the pill. There is, the minimal amount of hormone involved. And since there are so many different combinations, they can be tweaked to each person. So if after a couple of months, you feel like you're bloated or you have weight gain and you just don't feel right, we can have you switch to another one that might address that problem specifically. So the wide range is great. And I think it's really beneficial, especially for the woman who is very self-aware and can take a pill every day, because you do have to take that pill every single day.
And another person who would be good for the pill, a good candidate, is someone who might already be taking a daily medication. So it's not as much of an extra burden. It's part of their normal routine still. So that is someone who would have an easier time staying compliant to the medication.
Are there age restrictions on taking the pill?
No age restriction. I mean, the older you get, there's a little more risk involved just because of that hypertension, DVT risk. If you have some concerns, family history of breast cancer, you might not want to take that estrogen pill, but no real age restrictions.
And another thing to mention is a lot of people have heard the myth that birth control causes cancer, and that's not true. In fact, there's a lot of cancers that are a reduced risk if you're on birth control, like endometrial cancer and ovarian cancer are reduced. So I think that's a big myth also.
So does it seem fair that maybe the birth control pill got pigeonholed in birth control only when really it could be sold as like menstrual management more than...
That's a way better term.
Absolutely. Yes, for sure.
It seems like, there are so many other things that can be addressed with this pill. that the one common factor, obviously, is preventing unwanted pregnancy, but there are benefits across the board to be had.
Especially with people who have dysmenorrhea or irregular bleeding or abnormally heavy bleeding during their periods, it's a very successful intervention method to suppress some of those symptoms, especially around their menstrual cycle and flow.
Now, is this something that if this is your chosen method that you could stick with throughout your reproductive lifespan?
Absolutely.
Yeah, there's no reason to say no.
As long as we don't have that hypertension issue ever flare up or that DVT situation.
Right.
And it is increased risks of those things if you are a smoker. So that's something to consider, your personal habits.
Yeah.
But there are some disadvantages to taking the pill. You can have sore breasts, causes nausea in some people, spotting. But most of those things improve after a few months. One thing to remember with the pill, it does not protect you against STIs. You still have to use a condom or some kind of barrier method to protect you from that. But overall, it's a very proven, effective method.
Yeah, and I will also to say it's not as effective if you don't take it at the same time every day or if you frequently skip pills. So there is that user use that you need to make sure that you're on top of too. It's not one that you can just forget about, like one we'll talk about later, like the Nexplanon.
So while we as an organization can help offset the cost, what's the affordability like on the birth control pill?
For our clinic?
Well, in general too. I
mean, no cost. If you are uninsured or underinsured, it will cost you nothing for your supply. Most people, well, all people with no insurance, there's no cost to them. If you do have insurance, we are obligated to run it through your insurance, but you will have no copay, or you won't have to pay the extra amount. We'll take care of that. So still no cost to you.
Okay. And the good thing is, due to the ACA, most of the birth control pills I know will be covered. So that's a nice safety net to have.
So let's talk a little bit about that daily pill and the interaction of the hormones in the system. So I think a lot of people are going to understand that you are going to take that pill every day, but not every pill contains the same thing. And what is that, and why is that the case?
Well, there are multi-phase pills. There is a monophase pill, which all the pills are exactly the same. There's a biphase pill where there are two types of pills, one with the same amount of hormones and one with no hormones, a placebo. And then there's their triphase pill that has 3 different levels of hormone in them. And so it's just, it's worth a discussion with your doctor to find out which one works best. The monophase, you just take the same pill every day through the whole pack. And then once that last pill is gone, you just start the next pack. And those are the people that it's controlling their periods. It's maybe stopping the bleeding so that they don't have a period for several months, or controlling their bleeding. The biphase, lets you have a break and lets you have that period once a month. And then the monophase is just more of the regulation of the hormones in your body by how much you get at what time of the month.
And the triphasic and monophasic are the more common of the two. And the triphasic allows a period, if I'm correct. And those are the ones that will have different levels of hormones each week. So it'll look like different shaded colors pills. So 1 week might be light blue, the next week might be gray, and the next week might be purple or lavender. So when you look at birth control pills and they're different colors, it's just because they have different amounts of hormones, which the triphasic mimics a regular cycle, so to speak. So that's why there's different levels of hormones.
So what happens if you miss a dose?
Well,
talk to your doctor first.
Yes, talk to your doctor. You should probably don't double up on the doses, but go ahead and take the next dose. But you might refrain from having unprotected sex, the rest of that month.
Usually, if you take it the next day at the same time, as long as you've only skipped one, and so therefore you're taking your normal dose and your skip dose, so there's 2 at the same time, then you should be fine. But if you skip more than 1 day, talk to your doctor. Talk to your doctor anyway.
Yeah. Are there, anybody who picks up a magazine, watches television, reads the ads, and there's the huge long disclaimer. What's the disclaimer set for the pill? We already talked about, the interaction with hypertension, the DVT, those issues, but what are some other things that are the mandated warnings on the birth control pill?
Well, if you're pregnant and taking birth control pills, that is not good for the fetus. So we have to make sure that you're not pregnant, and that is one of the major concerns, for sure.
Again, like we said before, the breast tenderness, the bloating, the weight gain. Sometimes women can get some nausea. Those there could be some heavy bleeding in the beginning while your body adjusts. So like I said, sometimes it takes a couple months to really give it a chance to work and know whether or not it's going to work for you or not. And again, the no smoking. Really, really should not smoke.
And those side effects that Christy mentioned, those are typically, like she said, just in the first few months or weeks of taking the pill, and usually they subside, and they are usually acute. They don't last very long.
So you mentioned making sure that you're not pregnant while taking the pill. Is the pregnancy test something that we would do before we started somebody on the pill in the office?
Absolutely.
Okay. So it would be reasonable to expect that's part of your first exam is you're going to take a pregnancy test.
Correct.
Yeah, I wouldn't want anybody to come in and have an unwanted surprise, so that they can kind of prepare. I guess that's what you guys are for. That's why you're going to provide all that education.
Yeah. And that's really going to go for any form that you choose. We're going to make sure you're not pregnant before we start giving you medication.
So once we're chosen the pill, we're going down that path. How long before you're protected?
A full cycle, and then use protection until you've had a full cycle.
So it's not one pill and you're good to go.
Correct.
Okay. I am trying to think. So, and I guess one of the other things that's worth mentioning is that we are talking about birth control in terms of women only, that there is no pill for the men.
Not yet.
Not yet.
Don't even get us started about that.
Yeah. So, and I guess one of the other things I want to kind of go back to is this education piece. If you're talking to a couple, so they may be married, engaged, long-term relationship, excuse me, is that something that you're going to have conversations as a couple with the educator, or are you going to pull the female component or the user of the birth control aside and have a private conversation, or is that really directed by the patient, what they're comfortable with?
It's directed by the patient. Yeah, but we love sitting down with a couple and talking about their family planning, hopes, dreams. Some people, like for instance, I had a patient the other day who absolutely said she never wanted to have children. Now she's young, she may change her mind, but right now she didn't want any. And so that was it, no question. Yeah. But some people they want to have kids in 5 years, or they want to have kids in 2 years. And then there's some that don't want any at all. So we'll talk through all those things with them. If it's a couple and the woman doesn't want the partner in there, if she's solely worried about her body and her choice, then we will accommodate that.
Absolutely. And I do think that it is 100% up to the user if she wants the partner in there, and hopefully it's a good relationship and they want to have an open, honest conversation, because I think bringing more men into the conversation of birth control and family planning and trying to kind of take charge of their sexual health and their reproductive health, that more men need to be in this conversation. So I think it's a great thing.
And that's something else we'll do. We will educate, we'll consult with men. If men want to come up, what's out there, what are women doing? How do I know I'm protected? We'd be happy to do that too.
Yeah. And I think, having a partner who is well-versed in what the, potential pregnant partner is going through to prevent that is meaningful, because, I not only you're looking at what's happening to them physiologically, but there's an emotional component to that as well, which I think is really kind of the underlying to why we provide the education. It's one thing to just, because honestly, and you can correct me if I'm wrong, we could accomplish the basics of this by giving them a flyer. Right. But there's more to it than that. And that's why we have the conversation and provide all of the options, but it's to kind of get at lifestyle and planning and all of that you can't cover on a flyer.
And this birth control is just a fundamental tool that women have to have their own choice and their own power on their own time and decide when, if, and where they want to have children. If they don't want to have children in 5 years, then there's a method for you. And if you aren't sure what you want to do in 6 months with your partner, there's a method for you. So I think that this is the biggest piece to that, is to kind of let people know that you have many, many options, whichever mood you're in or whichever phase of life you're in.
One other thing I wanted to add was that if a patient comes in and they decide they want the Nexplanon, which is the implant, and we happen to be out of them on that particular day, we'll give them something else like the patch or the ring or to use until that comes in and we can get them in the office and get taken care of. So yeah. We're gonna make sure you're covered the minute you walk out the door in some capacity.
Yeah.
And we'll give you some condoms so you have a backup method for those first few days and weeks when you're starting your new method. So,
because right now we have experienced, I think, what the rest of the world has experienced. We've got some supply chain issues, but we do, like Christy covered, we do have our pills in stock. We have a lot of options on hand. There are just a few methods that we're waiting for them to get shipped to our door. So, but yeah, the pill, I think, is something that has been readily available and is readily available. So it was the first thing we had to provide through this program. So, anything else you want to add about the pill, about programming?
Yeah, I also want to say it's also something that if you don't like a certain symptom, if you're on your birth control pill and you don't like a certain symptom, definitely let us know, and we can work with you and see if this is something we can manage or if this is something that we want to switch. So I just think being aware of what you're doing is the best way to do it. So.
Yeah, you're not forced to be locked into your first method.
Right.
And if you choose an IUD later on, if later down the line and in 4 months you meet the man of your dreams and you want to have babies and start your life together, then we can always go in and take that out. So it's up to you. It's your choice.
Yeah. And I think it's also important to remember that this is kind of the one-stop shop. We are going to, everything is done with our staff in our office. So you're not going to be shipped to another location. You're not going to deal with other providers. You're going to deal with us. So I think that is a huge benefit of this particular program is that they've designed it with the intent of being easy and supportive of the people that we're providing the services to.
And also, just in light of COVID, we're going to put you in one room. We're not going to move you around from room to room to room to talk with different people. We're going to come to you, and we're going to make sure you're safe.
Yeah. We just to cover our basics of COVID process here. You can tell Christy, Allie, and I are in separate spaces. We're in separate buildings in some cases. We're not wearing our masks because we're by ourselves in the safety of our offices or secluded space. We function very much like that throughout the entirety of the clinic. We interact with you where we have to, and where we don't, we provide distance. All of our staff are going to be wearing masks in the clinic when you come in and interact. You are going to be socially distanced during that interaction, and we're going to try and keep our total interaction time limited with each person, because we know evidence has shown that the longer you are exposed to an individual, the more possible it is to transmit. So we're going to focus on limiting that time and exposure to protect you and all of our patients.
Right.
When you arrive at the building, you will have to ring the doorbell and get let into the building, because our building is still secured because of implementing mask procedures and COVID procedures. You're going to not be in the waiting room with another bunch of people. We deliberately are scheduling our appointments to ensure that there's not a group of people in our waiting room. It's usually no more than 2 or 3 at the most right now, so that you can be spread out and not sitting next to another person. So we really have modified the experience of coming into the clinic to ensure that it is as safe as possible. And with that, nose itch. With that, I will say we will be back next month to cover another method with Christy and Allie. I would encourage you to share this across the platforms with other people so that they can get to know us and get to know the program. We know there are a lot of people out there who can benefit from the Right Time initiative and get connected with the birth control option of their choice.
Even if you just have questions, if you aren't sure you want birth control, this would be a good first place to stop by and inquire more, because we have a lot of information to give.
Yep. And again, if you've got those questions, info@spectrumhealthcare.org, and I can get those emails to Christy and Allie, and we can address your questions and concerns confidentially. We want to make sure that we are honoring everyone's desire to be safe and private when they're making this extremely personal choice. So, all right, gang. Well, thank you so much for joining us. We will see you next month. Thank you to everybody on behalf of the Spectrum staff and board of directors. If you're looking for a place to receive exceptional, culturally competent care with a team that is truly dedicated to your health and the best health outcome for you, please give us a call and schedule an appointment. We'd love to be able to provide you with excellent health care. All right. Thanks, everybody. We will see you again soon.
Thank you.
Thank
Bye-bye.
you for